Our second speaker in this half hour is going to talk to us about how technology is transforming patient healthcare. David Wall is Chief Information Officer with Tallaght University Hospital, and he's going to talk to us about virtual wards. Thanks, David.
Actually, the title of the presentation has changed to Digital Enabled Care in a Post-Pandemic Era, but it's okay. It was only yesterday. Good afternoon, everybody. I hope you're enjoying the conference. I had a wonderful presentation prepared. I had my speech and everything lined up. And then Brian started this morning and spoke about the importance of time. Time for patients, time for staff. And that really resonated with myself and what we do in Tallaght University Hospital on our digital enabled care. Then Roland stood up. And Roland stood about our anytime, anywhere culture. And that took a lot of my slides out as well. And then, because again, that represents what we want to do in Tallaght University Hospital. And then we had the panel discussion, and we all know where that went. But again, I suppose one of the things that Roland talked about was the persist model. And I think that's important. You need to persist in the health service. Anybody who knows me, I think that's one word they'll use about me. It's persistent, or also he's a pain in the ass at times. But you have to be to get things done. So in Tallaght University Hospital, I suppose I'm the Chief Information Officer. I'm very lucky to be that. I'm a fellow of the Irish Computer Society, and I represent the Health Management Institute at the European Association of Hospital Managers IT Working Group. So I do have some qualifications about this. But I'm also a parent. I'm also a husband. My wife is a midwife. When we got married, people said it wasn't bad enough she had one vocation, wanting to be a nurse. She took on a second one and married me. That's supposed to be the joke. That's good. Always good to get a delayed response. Both my parents died of cancer. My sister's a carer. My mother was a carer. I have two nieces who are nurses. And my daughter is trained to be a lab scientist. So I get it from all sides. And I mean that genuinely, because digital is here to improve the life of the patient. This year as well, by the way, as some of you may not know, is Tallaght University Hospital's 25th birthday. So we opened 25 years ago, and we'll be celebrating that later on in the year. That's just some activity around the stats of the hospital. I won't focus on that. What I really want to talk about first is the hospital without walls. Now, that's not about getting rid of me. That was actually a term that we came up about our better healthcare through improvement. So a number of years ago, Tallaght University Hospital recognised a shifting pattern and change in healthcare and started to move its services off campus. We don't say off-site, we say off campus. And as well as that, with Sláinte Care coming along, we are now involved in a number of enhanced community care projects and a number of initiatives. But I suppose from my perspective, what that meant to me is we wanted our patients to have the same experience no matter where they went. So whether they were in the SINS building, which is our outpatient facility, the community radiology unit, which we run on behalf of the HSE, or in the main hospital, that's the same information, it's the same experience. There wasn't going to be this disparity between their care. So the entire digital enabled care strategy we have in the hospital is built on that principle. So I got this slide just after COVID, and I've been dying to use it. So I said, this is the best one. So the answer, or the question was, who or what has led your digital transformation? And a lot of people say, well, COVID. Well, that's not necessarily true. There is a lot of good work and has been going on in the health service for many, many years around digital. I'm actually, despite my youthful good looks, 30 years working in the health service, believe it or not. And I have come across colleagues who work across all areas of the health service doing good work. What I think COVID has done is accelerate digital transformation in the health service. But it has also, I suppose, brought the realization to CEOs and to those execs that you should listen to your CIO and the other guys, because they actually do know what they're talking about. And there are solutions there that can help. This is from a Gartner study in 2021, and you'll see it's where they forecast digital technology investment was being made. And you'll see I've ringed the top ones there. You'll see there's a lot of talk today here about EPRs, and rightly so, it is an important component. But where is it listed in the study? You'll see it's 1, 2, 3, 4, but the fifth one down. And I suppose the reason I'm pointing this out is our digital enabled care strategy in the hospital is very much built around different solutions. It's not just an EPR. We have put many different solutions in place that will serve the needs of the patient. This is our platform, again, based on a Gartner model, but I suppose what it illustrates is that we have looked at many different solutions, many different areas of healthcare, and we are implementing those solutions, be it an AI-based one, be it an EPR-based one, be it sensor technology. Hopefully through the different solutions I'll be showing you here, you'll get a sense of that. I got a bit worried because it said 5 minutes and then you've changed it to 9, so I'm all right now. I was starting to rush. But the patient is at the centre of everything we do. And all of this is built on a privacy by design model. It is built on trust and security. For my sins, I am also responsible for information governance in the hospital as well. So when I'm putting solutions in, I also have to make sure they comply with all the relevant legislation, etc. So our first one, and again, a lot of people call this artificial intelligence, but we call it assisted intelligence because we are not trying to replace healthcare professionals. We are trying to help them. So a number of years ago, and again, one thing I have to point out is the team in Tallaght University Hospital. We have a group of clinicians, nurses, health and social care professionals who are so invested in making things better for the patient, but also using technology to do that. That's further backed up by the executive management team and our board of directors who have taken some very brave decisions in what we have done and put me on the naughty step in some places, but it has been worth it. So the first one we implemented a number of years ago was from stroke thrombectomy. It's a brainomic solution. And what this does is it allows our stroke consultants, it applies AI intelligence to analyse the brain and points them to where there are possible problems for the patient. Our consultant, Dan Rye, will tell a story there where he was in Spar doing his shopping and a patient was brought into the hospital. They were brought in to put the scanner, brainomics worked. He got it, beeped on the app on the phone. He seen what he had to do. He contacted the reg. The reg said, I haven't even taken the patient out of the scanner yet. That's the difference this can make. And it actually pointed him, and I am not a clinician, but on that particular case, it pointed to an area of the brain he wasn't going to look at initially, but it said, you need to have a look over here because there could be something going on. So that was our very first artificial intelligence project. Then we have our Gatekeeper project, which is around analysing how somebody walks. So again, accessing the traditional tools to measure your gait analysis and how you actually walk are very expensive. This is an app that's been developed with a spin-out company from DCU through Sean Kennelly, one of our age-related consultants, which again, within a matter of minutes, can carry out the same thing. And the third one there is around PillCam. Now, Tallaght University Hospital was actually the first hospital to deploy the PillCam technology, where you swallow the pill, it goes through you, and then it films it all the way in. Where that's gone to now is it applies AI technology to analyse those studies. So it's reduced, on the last one I read, it reduced something like 40 of the studies down to 15. So what that meant is the technician only had to look at these 15 and not the 40 studies in relation to that. So again, that shows where assisted intelligence, not artificial intelligence, can aid our colleagues. Robotics is another area Tallaght University Hospital is focusing on. So our first foray into that, like many hospitals, albeit a bit late, has been in robotic surgery. So again, we have deployed a Da Vinci robot for our urology consultants, I think, as far as I remember. And again, I'm trying to remember all these terms. And again, that's already seen benefits, and we're hoping to expand that. The next one then has been in age-assisted. So again, last year's part of the Innovation Fair, we had those assisted robots on site. And again, we're looking to explore how that can be of help, because you've all seen how that can assist people, how they can act as a conversation, how they can interact with people. In Japan, they're using robots to lift people. So again, to take the pressure off, healthcare workers and sustaining physical injuries. We have plans to deploy robotic dispensing in our pharmacy. So we have a whole pharmacy modernisation programme, and then moving on to automated dispensing cabinets throughout the hospital. So again, improving the whole pharmacy supply chain, but also it's all about electronic prescribing and medicines administration. In the future, and this is one I am finding a bit of resistance on, is the movement of goods and services. So again, this is well deployed in the hotel industry. You can go to some hotels and you will get, the robot will come up to your room, or you go to Japan and the robot will serve you. The robots in Japan are actually powered by people with physical disabilities, so they speak. So it's a fabulous model. So again, there's lots of potential here just for the movements of goods and services around hospitals. Telemedicine. Again, Tallaght University Hospital was one of the first ones to deploy telemedicine through the Trasna Stroke network. So Dr. Ronan Collins, who's the nice guy in the picture there, is our national lead around stroke. So again, that supports about 20 clinicians working across Tallaght, Naas, Kilkenny, and a number of other hospitals. So as you know, with FAST, if a stroke patient presents, they need to be seen immediately. If the consultant is not on site, the robot can be powered up. It can go to the patient in the ED. The consultants log in on their laptop, and then they can interact with the patient. During COVID, we deployed a very cheap and cheerful solution there. It's the one in the middle there from Double Robotics. It's basically an iPad on a stick. A lot of you probably would have seen it in Modern Family. That cost $2,500. What that was used for was telecare, for going up to patients in the bedside, conversing them when the clinician wasn't on site. They then found a really novel use for it around exam time. So some of the consultants couldn't make it on site for the exam. So they drove it, because it can be controlled by an app on your phone. So it's housed, it's charged, it drives out. They used it to conduct some of the exams when the consultant could be on site when they were doing the bedside exams with some of the patients. Very novel. We did deploy the Attend Anywhere video solution. And again, similar to one of the previous speakers, the take-up on that hasn't been brilliant. Surprisingly, our telephone consultation is running at about 25%, which is interesting. Our face-to-face is still about 70-71%. So again, for certain age populations, that hasn't been a great take-up. That said, my kids, 19 and 22, they need their GP appointment. They'll get it through our health insurance, but they'll go on and do it virtually. And the script is emailed. So it's different for different genres. And actually, that's an important point to make as well. The health service doesn't have the luxury of deciding who we see and don't see. Our patient profile is 0 to 110. They come through the door. We're not like a hotel or a bank. We can't turn them away, but we also can't say, well, you're only going to do it this way. So we do have to cater for different needs. Then during COVID, we deployed two very novel solutions. Again, two Irish company, Red Zinc. These were the glasses with the cameras built into them. So again, where our consultants couldn't go into certain places, the staff wore the glasses, went into the area, and again, the consultant could give their advice remotely. It was also used for buddying for staff. So as you know, we all had to deploy staff during COVID to areas they weren't familiar with. So when you put somebody into a theatre that's not typically a theatre nurse, they're not as familiar with the place. So what we were able to do is they could wear the glasses, and a theatre nurse could actually then help them. No, you need to do this, you need to do that. So we found some very novel solutions. We also deployed Amazon Echoes throughout the hospital as well to reduce the use of PPE. People could go in and out of we're going in and rooms having to change. So again, this was helping people communicate. And then we deployed remote telemetry throughout the hospital as well, so we don't have to keep our telemetry patients in one place. We have a very important concept in the hospital around releasing time to care. And what that means is putting innovative solutions in place that give time back to the nurse or give time back to the doctor or the HSCP to spend with the patient. And we call it releasing time to care. Some of the solutions, and I won't go through them all, you'll be familiar, but two I do want to point out is single sign-on. As you know, we have a myriad of systems in the hospital, and you have to log on with different usernames, different passwords, different expiry times. Single sign-on technology, we did the pilot on that. We saved the average nurse 59 minutes per day. That is a proven study validated by Imprivata. I let you do the math for the health service. Leading from that, we convinced the HSE, and we did the national tender for the HSE, and I'm glad to say that has been approved, and the phase 1 sites will be implementing that this year. That is something that will save time. The second one is around electronic vital signs, and again, another Irish company, Synchrify. Again, we did the pilot of that before the national programme. So this is where you connect up the devices that measure your blood pressure, etc. And so previous to that, you would have had to chart it. So and the nurses will all be familiar with the chart, that you have to chart out all the obs, etc. Here, all the information comes electronically from the monitors straight onto a central console and charts out. Not only that, then it will escalate if it has to calculate your early warning score. You can also do an kidney AKI as far as acute kidney injury. So again, what that is doing is saving time with the patient. It's also saving time for the nurse. So again, two very important things. Patient engagement, we talk very much about the digital front door, and again, this is really important. And again, Tallaght is looking and leading the way in this around apps. So again, this whole thing about the access anytime, anywhere culture. We have deployed patient and staff apps in conjunction with Enterprise Ireland. We're working on a COPD app, and in conjunction with My Patient Space and Professor Kevin Conlon, he has now gone live, nearly going live, I should say, with a pancreatitis, I have to get that word right, pancreatitis app for patient care. And Tallaght University Hospital has been using the patient portal in conjunction with SwiftKey for many years. Our patients, if they come for their blood appointment, have to book that online, but also for our community radiology, they have to book that online as well. The age relation from that is all the way from 20 up to 18-year-olds using that platform. So again, I get the point about not trying to exclude anybody, but there is evidence to show the silver surface there, do use it. Scan for safety, and I'm nearly out, and I do apologise for this, is another one really about track and traceability. And again, that was deployed with an Irish company, Genesis, using GS1 barcodes, where we're able to track and trace the use of goods throughout our theatres. We started with 2 theatres initially. In the first phase of that saved across approximately €70,000 in waste. And finally, and this is important, is around our electronic patient record. There has been a lot of talk around the electronic patient record, and it is very important. The model Tallaght University Hospital has adopted is around what we call an interface or open EPR. So what we have done, instead of going for a single solution, we have kept some of our existing solutions. We have bought complementary solutions to that, but integrated them all into one overall summary care. Now, again, it is fire compatible, it is HL7 compatible, so we can share any information with anybody based on standards. The benefit of this approach is we are a combination of HSE systems and Tallaght University Hospital systems. It also avoids a big rip and replace and helps with your culture. That's just a platform now over time, so I won't go over it. Just some stats around that. We've now removed all the phase 1 documentation associated with phase 1 of our electronic patient record. We've ceased the printing of our GP lab and non-lab reports. We will be working on radiology. We fully implemented the EPR across our 12 theatres. We'll be extending that to endoscopy and dermatology shortly. We started work around phase 2, which is around digitising the inpatient documentation. We've done a catalogue. Did you know that Tallaght University Hospital has 976 documents in its patient chart? Blank. 160 of those, when we catalogued them and went to people, nobody knew who owned them. Nobody knew what they were used for. So that left us with 800 documents. 876 documents we're going to digitise. We will be deploying our pharmacy and electronic prescribing solution. We've also, our GPs will come to us now looking for pilot access to Synergy. Sorry, I meant to say Synergy is electronic, but this thing is really putting me off. And we're very heavily involved with Sláinte Care, enhanced community care projects as well. I suppose, again, this is very important. Everybody has talked about culture, and they're right. If there's one thing that's going to be on my tombstone, it's going to be 3 words: people, process, technology. And everybody in work is fed up hearing me say that. But it's really important. You must change how you do things. If you don't change how you do things, there's absolutely no point in having an all-singing, all-dancing digital solution. It won't be used. If they don't have Wi-Fi, if they don't have desktops, if they don't have faith in what you're doing, if they're not prepared to buy in and work with you, nothing will change. You will have a very expensive digital solution sitting there with nobody using it. So it's really, really important. And finally, this is what digital-enabled care is about. But it's also about the people. It's about the ecosystem. It's about you people in the room. It's an industry. It's an academia. It's a healthcare partnership. We have partnerships with Amazon. We run a hackathon for every year, which has been really successful with the TU Dublin students. We also have a digital internship program where we take people in their 3rd and 4th years into the IT department on a paid digital internship, which is funded by the hospital. Those staff, thankfully, have actually then joined when vacancies have arisen in the department. So it's a talent pipeline as well. And finally, I seen this at the weekend. I thought it was very important, and it was about Irish, involvement in space. So this is what, and I'm not known for this, so this is actually new for me. So I'm going to leave you with this thought. So no matter how large or small your role, you are contributing to the moonshot within Irish healthcare. Where we all embrace that type of attitude and belief, incredible things will happen, but you will make them happen. Thank you.